Good evening, friends. Today I am very honored and very happy to introduce my very close friend, my brother, Dr. Jaswant Patil. As you all know, he requires no introduction, but still I take pride in introducing him to you all. He is basically an allopath, M.D.Chest, and then he was a staunch allopath before. He was a lecturer also in a medical college. And friends, after something happened in his life, he studied BHMS. He did his BHMS. He started believing in homeopathy. Then he did the course BHMS. That is after M.D.Chest. And he's one of the topmost homeopaths of the world now. My dear friends, Dr. Jaswant Patil was a member of task force for COVID in Maharashtra. And Dr. Jaswant Patil is also a member of advisory board CCRH Ayush of government, and he's a he's a Rotarian. He runs his chain of clinic, Deep Ganga clinics, total health solutions since 1992. Okay, so that is almost since last 30 years, and he's been practicing since last 35 years. He has done his MBBS from Grant Medical College, Mumbai, and MD.Chest from St. GS Medical College, KM Hospital, Mumbai. As I told you, he was a lecturer in KM Hospital, also KM College also. He has worked in general medicine, cardiology, ICU, ICCU, IMCU, ITCU, and hematology department. Okay, and there are so many achievements. Needless to, I mean, there's a huge list, at least more than 100 achievements, and he's been awarded with so many awards. You name the award and he has it, friends. And the best award is the award to homeopathy in India. I take pride in introducing my brother, Dr. Jaswant Patil. You all can unmute your phones and we'll welcome him with a round of applause. We will clap for Sir. And without wasting more time, I would want to hear Dr. Jaswant Patil. Over to you, Jaswant.
Thank you. Thank you, Liyakat Bhai. It was impossible today, but I can't say no to Liyakat Bhai. He's my close friend, brother, and everything. We discuss very candidly. We discuss, we even contradict, we criticize, but we come finally on the same platform. I learned mind from him. He wants the physical side from me, and that is what is give and take relationship. And that is fine because being an allopath, I have treated cancer cases in lung. I was giving myself a chemotherapy and in JJ Hospital, KM Hospital. As a lecturer, I was managing all these cases with fiber optic bronchoscopy. Then managing even in the ICU the temporary pacemaker implantation in case of an heart attack. So my endeavor, right from the beginning, and my mission and passion was how to save a patient, how to make him happy, how to free him from the diseases. And what allopathy has taught me, it is a very hard training. If allopaths are talking against homeopathy, I am not surprised because I was one of them. And why they talk like this? Because we lack research. Now research is happening. I'm going to talk on that. You know, Dr. Hahnemann was an allopath. And why did he shun the practice? Because people were dying more by the treatment than by the disease. 200 years back, our allopathy and homeopathy, they started. Allopathy was going on, homeopathy was introduced. But there was no research and development in allopathy because treatment of blood pressure was bloodletting. And that was the thing that you should now understand what I am talking about. The bloodletting treatment today, in 200 years, how much they have expanded? They have expanded to a larger extent in the sense that today there are advanced treatments that has put them to the forefront. And what homeopathy has advanced in 200 years? we are still at a classical homeopathy. No doubt, classical homeopathy is the best. But classical homeopathy requires so much of expertise that it's not everyone's job. Even if I take 10 topmost homeopaths of India and send one patient to all 10, they will come up with different remedies. Now, who is right, who is wrong? That is this. So this is always thing that I am seeing 200 years in homeopathy. There is theorization, postulation, hypothesis. I feel that, I feel this, I feel that, and that's the reason homeopathy has not advanced. Homeopathy should be, it should be easy, it should be reproducible, and it should be practiced by any homeopath who passes the college. I was appearing for a BHMS exam. That time my age was 45. I think between 45 and 50 years of age, I did my BHMS. Before that, I was practicing homeopathy about say 15 to 20 years. Then I thought a need that I should have a regular degree, and I wanted, because mostly my allopathic practice was negligible, hardly 5-10%, 90% was pure homeopathy. I started my journey as an integrated, one dose of homeopathy and one prescription of allopathy. Finally, I came to a conclusion that homeopathy is the best. I resorted to stop the integration, stop clinical prescribing, switched on to a classical single dose at a time, no repetition over the time. And then I started doing all these things as an homeopath. I was getting marvelous results, no doubt. If you catch the mind, if you catch what is to be treated, what is treatable in the remedy, that is what Hahnemann doctor has said. The results are marvelous. But, and I would show these all slides. See, I have cured this case, I have cured this case. But what about failures? Are we so sincere and are we so honest that we talk about our failures? No, that doesn't happen in homeopathy. And students who are listening, they feel, ki, oh, this is only the cup of tea of the stalwarts in homeopathy. Those who are ace prescribers, those who are very intelligent. Such type of homeopathy will never progress ahead. And what we have faced today in India, that homeopathy is number one, I would say, more effective than allopathy, because allopathy wants to know everything and then prescribe. Our master has given us 200 years back. Today, we don't need the diagnosis, we don't need the disease, we need the proper application. But that proper application is so intricate that even Dr. Hahnemann had seen that he has changed the remedies over multiple times. And at the end, that is when sixth edition was to be put in, Dr. Aegis has written about this in his autobiography, that Dr. Hahnemann was using multiple remedies, not mixed together, but placed at different intervals, sometimes an hour, 2 hour, 3 hour, or days. And when I saw that time, I said, what I am doing today, I was feeling I am not doing proper homeopathy, what is there? But finally, what Dr. Hahnemann said, the mission of a physician is to cure the sick. And it has to be cured in a proper Hering's laws, in a proper right direction. Either you go straight forward, zigzag way, but final goal is to cure the sick. That is most important. And therefore, this I am telling you what was my experience later on. But when I was practicing from integrated, one prescription of allopathy, one dose of homeopathy, marvelous results. My indoor went down, my OPD increased double fold, triple fold. And then I thought that there is definitely a scope in homeopathy to bring happiness to the patient's world. Finally, I had to close down my indoor because hard to manage and maintain. Hardly 1 or 2 admissions, OPD from 30 to 150. So that was a power of homeopathy that made me more passionate and more dedicated towards homeopathy rather than mixing allopathy with homeopathy. But in some cases, I required because long-standing diabetes. Now, even if our homeopaths are suffering from diabetes, what do they take? finally the goal is to achieve the strict sugar control. That doesn't happen. There is still homeopathy, allopathy is required, because and we have the powers of that, but we are not developed. We are not done the proper research, development, put in the protocols. So there is a fixed mind of homeopaths. They believe one school of thought and they will follow only that school of thought. These ideas, see, homeopathy is not a religion, it is a science. And therefore, it should not be compartmentalized that, oh, I follow this method, I follow this method, I follow this method, I follow that method. You follow any method, but ultimate aim is to cure the sick in a rapid, gentle, and permanent restoration. A permanent restoration would come in a totally curable case, but not in the incurable case. For incurable case, one-sided cases and everything, what Dr. Hahnemann has said, do palliation. But I have seen that even in these cases, if we apply the knowledge properly, and if we work hard in proper honesty, integrity, and work for the patient, to give the time, give proper follow-ups, this can also be cured cases. Many times, then what is the once you're cured means how long you have to wait? 5 years. After 5 years, you can declare, yes, I have cured the cancer case. Today, we have selected topic of cancer, and that is after Dr. Liyakat said that we want on cancer, and we want to work together in a cancer in a different way, sometimes in the individual or homeopathic way, integrative way, but we want to bring these patients out. It is sad, and Liyakat Bhai has recently lost his mother. I pray for her soul to be in the heaven, and we all pray. And it was a very difficult moment. He was shattered, even I was shattered, and things are that these things, proper cancer, even today, what I am doing, it's very difficult to cure, and that is what he also faced. I also faced. We both are like brothers. I had a very sad day that day, but ultimately she was of that age. It is okay. Everyone has to pass at that age, but like it to my mind, and this also we need to study properly and see that even in cancer cases we can bring the happiness and restoration of the health to the normal. So we chose this topic today, and this is my first presentation on cancer in detail. Otherwise, I have shown cancer treated. I have shown n number of cases in big seminars earlier also, that see how this case is cured, this case is cured in the short. Today, I want to give time, and we want to see how I approach the case, so that every one of you will get an insight that what should be the approach to the case, because it is very important. I would share one of my experience that I was an integrated homeopath with allopathy, then a classical homeopath, and then after getting good results, even in classical, complicated state cases started coming to me where I was failing, even with other individualized remedy and this. And I was afraid, no, we should stick on to one remedy or change that remedy, put in another, follows well, complementary. But the time was lost. Cancer doesn't wait for you to react and act. It takes its space. It walks with a speed, and you have to match that speed. If you don't match, you lose the case. And that is what I had learned. So there are many failure cases also. There are very positive cases also. There are relapses also. And each case has taught me many things. I have treated thousands of cancer cases. And finally, I have come to a conclusion that there has to be a proper association and proper change in the approach of homeopathy and its remedies. So I would quote here one case that there is one patient with carcinoma of unknown origin, metastasis to liver, brain, skeletal region, and peritoneum with huge ascites, getting emaciated. I was trying by my classical method and treating, and Finally, he was feeling little better, energetic, thoda khane lag gaya, thoda weight badhne lag gaya. I was happy. But in that, the time lost, and then finally, one day he collapsed. And collapsed, then he was taken to Mumbai. There, allopath said done something, and again, he was fine. And then he went to an homeopath in Bhiwandi. I salute that doctor. I don't remember his name, but he cured him. He cured him to such an extent that when he came back to me after a gap of 1 year, I was surprised and astonished to see him that his ascites is gone, his metastasis gone, everything got cleared. I said, what did that doctor give you? I wanted to know because you learn from our colleagues. Everyone learns, and you must always share your knowledge. Don't be afraid कि मैं किसी को knowledge दे दूंगा तो मेरा practice करेगा. That is a wrong attitude because in allopathy is forward today because we share the knowledge in allopathy. एक corner में one drug, if someone molecules discovers, everywhere it comes and doctor starts using it. But unfortunately, there are a lot of side effects. Like this, all the wizard and the ace homeopaths, if they start expressing the truth, what they have done, what they have given, even if they have faced the failures, even if they have faced the shortfalls while treating a case, even if they have lost the case, but we can learn from all those things. And successful cases, just we see, oh, this drug was given, so I am going to give all these drugs all the time. No. So from the integrated to this classical, from classical to when I saw this case, Bhiwandi doctor treated, he was a homeopath. He had given some 10 or 15 mother tinctures and different types of doses to be taken morning, afternoon, evening, and one placebo to be taken at night, Saclac. So I was astonished. This is not homeopathy. This is not homeopathy. This is wrong homeopathy. But Baba, that man is saved. Oh, you are for homeopathy or you are for the patient? Dr. Animan has clearly said, and he required 6 edition to reach. But the life was short. If you would have lived by now, today, our homeopathy would have been somewhere else. But no one dared to be wise. We always say, or this and what we do, we don't dare to be wise. Same thing happened to me in COVID. Again, from that, I was prescribing, but again, that comes, no, this is not right homeopathy. Come back to single dose, not multiple dose, this, that. Again, in the COVID, what happened? COVID, we give single remedy, patient feels better, he relapses, pneumonia increases, oxygen drops, we are not using, and then again, finally, we lose the case. The first case I lost in COVID, and then I said nothing doing. I'll go by the pathology. So I read the post-mortem of a COVID patient done in Italy. And there, from the pathologies of the COVID, what was the main thing was attack on the blood vessel, inflammation of blood vessel, took a rubric from generalities. And based on that, whatever individualization I could do, I did for 2, 3, 4, 5 medicines. Then pathology, from blood vessel, it has gone to alveolitis. Alveolitis will damage the membrane, oxygenation will drop. Pneumonia formation, secondary infection. So abscess remedies. This 1, 2, 3, 4, 5 oxygen remedies. I have 5 remedies. 1 hourly, I gave the second patient, and he showed the recovery in 24 hours time and 48 hours. And 3 to 5 days, he was normal from such a bad oxygen level to such a moderate to severe case disease. He was not required to go to the hospital. That gave me a confidence. No, what you do is right, what you think is right, and what you are saying is right. Be confident in yourself and dare to be wise. And that is how I changed from that time again. And again, my approach started changing. But in cancer case, this particular case, which I gave you an example, I changed over to that and finally started prescribing not single remedy for a cancer, which are irreversible, and started giving multiple. To an extent that I started getting people visiting from Tata Hospital coming to me. Doctor, will you be associated with us for a research? I said, why not? But there are some conditions that I would like to put. I said, but why you want to be, you people are the against of homeopathy. Well, we have seen your cases crossing us. The case which we are told 3 months life, and I'm seeing 3 years is surviving. Well, here, any molecule in allopathy, even if it increases the life by 1 month in the trial, clinical trials, that is being put into the market, and the one injection which is costing 50,000, 60,000 is the cost of one injection. I said, because you charge so much, therefore you can do the research. We can't charge, therefore we can't do the research. And we have got more effective remedies than that, but still we are backward. Still we are, means we have got um, the gold and the diamond in our hand, but we are not able to polish it. And that's the reason our homeopathy is today lagging behind. I would be happy that day when there will be protocols and clear-cut answer. Like if you get a fever, you give paracetamol, fever comes down, that sort of action should be there. If I think you all people think this has to be the single remedy, it should be sure shot remedy, and it should be reproducible by any newcomers also. So newcomers are always afraid of this giving. How can I give? And therefore, I said I experienced that during my exam time, which in between which I was telling you. I asked after paper is over, I used to talk to student. What are you? No, no, sir. We are going to get a degree, and then we are going to practice allopathy. I said, why? I am a MD allopath. I got so much of experience. I've come to homeopathy. This is the most powerful science. Why the hell you want to go there? You want to leave diamond and this, and you want to go for the steel? No, you should not. No doubt that is perfection, but we are going to develop perfection one day. And well, if no one teaches us properly, we go and see why this remedy is prescribed. No one tells us, so it becomes difficult. And once we start, then I have seen other colleagues who have started the homeopathy and they could not give because they could not find simillimum visualization, classical homeopathy. I said, see, initially, whenever you start, you have to start with zigzag method. Don't go on these definitive methods. Giving results is most important and not doing harm. And homeopathy never does harm. There are so many myths in my mind. If I give this, it will cause this will cause this will cause this, that. No, my dear, it doesn't happen. I've come out of all those fears and restrictions. So many years I was just saying, which patient to give, which potency, 6 potency, 30 potency, 200 potency. Nowhere there is clarity. Everyone has got a different views and ideas and everything. So I practically did experiments more intensively when I was confident that homeopathy can never do an harm. I'm sure about it. And I have tried on my family members first because I said if it does harm, as a doctor, I can handle because they are in front of me. And for 28 years, mera bachcha bada ho gaya. We had not required even one dose of allopathic medicine. It was once he had a pneumonia and he was not responding fast growing of the pneumonia. I said, he will require an ICU. But luckily, I had given him some out of desperation 6, 7, 8, 9 remedies and it was not helping. And finally, I called Dr. Vijay. He was a very good friend of mine and a very I respect him. Is to respect. Today also I respect him. He was an intelligent homeopath and a very good prescriber. He said, "You give this." I said, "Already given." You give this, already given. Give this, already given. Give this, already given. But how many remedies you are given? I said, fever is not coming down. The right remedy will bring down the fever within 1 hour. Some 0.2, 0.2, 0.2, 0.2, 0.2, 102 से 101.8, 101.6, 101.4, 101.2 ऐसा करते 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 it should come down. That is the right remedy. And you can't wait then. हाँ अभी आएगा धीरे धीरे आएगा. You lose the time, patient goes bad, and then he has to go to allopathy, and then finally homeopathy gets all abuses from the allopaths. कि तुम केस खराब करके बेचते हो. In short, what I was saying that these all confusions which I cleared, I am going to present. in front of you my experience. My experience, that doesn't mean that it's a final thing. You can also do that, and you can change my wordings also, my vision also. Everyone has to put, nobody's perfect in homeopathy because it is an unresearched science. It is based on some old principles. But today the world has changed, the time has changed. Where the allopathy has gone, we are still at that stage. But still, I tell you, the classical prescription is always, I put it on the top. But everybody can't get a classical. That everyone will agree with me. That you try to give all 10 patients classical and all 10 patients get well. Be truthful and be honest, and be honest to your students also. So there's till the time you get a right prescription, you have to go by the zigzag way. And I'll show you one case today, how I have come to the conclusion. So I'll share the PPT. Yeah. A case of prostate carcinoma. This is a case, a very important case I'm sharing with you. Case of prostate carcinoma with lung skeletal metastasis. A known case of diabetes with hypertension and cough, poor appetite, edema, feet, breathlessness, weakness, numbness, low backache. In the OPD, came to me in Deepganga and was undergoing homeopathic treatment. Now you see what I have given right in the beginning is that I've talked about diagnosis. Now diagnosis is not at all considered in homeopathy. That should not happen. We should now start concentrating on clinical diagnosis way and then prescribe accordingly to control, make the huge difference in homeopathy ahead. I've started my thing. I am alone. I can't do. I need your cooperation. There was a lot of criticism, but I disregard the criticism, because if anyone would have bothered about the criticism, homeopathy would not have advanced. There was so much of criticism. Anything new ideas put first, we don't like it. But finally, I only remember the final words of Dr. Hahnemann: mission of physicians to cure the sick, and mission of doctor is to restore the health. Rapid means what? Rapid 1 साल 3 साल 4 साल 5 साल, no, the चलता है, इलाज will be लंबा, but the patient should start feeling better as fast as possible in a gentle way. He should not suffer. If he suffers, that time again you have to take care of that. And permanent, so permanent incurable cases and maintenance in incurable cases. So what is more important here now? Prostate. So one is prostate gland, then bones, then pancreas, circulatory system is hypertension. Okay, I go like this. Okay, breathlessness is lung. Okay, these are the symptoms. Now edema and numbness is again nerves. Okay, so now first gather, like you write a history. Now you start writing another page. कि कौन से organs involved. You must know, because sphere of action of the remedy, if you have selected properly by any method, if it is not matching that. Now in 200 years, so many remedies have been put in, the organ remedies, pathological rubrics, they have been put in. So we know if that is not that, that doesn't mean that our remedy selection is not. Now we are going to give that, if it is matching with our simillimum very nicely, Then after getting a result, we are going to put that remedy into the pathological rubric. So we'll get a big database. And then how frequently this remedy has been there. Now CCRH has opened up the website where they want all this, us to put the cases, so that we'll come to know this remedy has cured this cancer of prostate. So if 100 people are saying with this remedy prostate cancer, it will be on, and something, the things will come out. So the rapid, the case shows efficacy of homeopathy in rapid regression, prevention of recurrence, and improving general quality of life. Prevention of recurrence for a short time, even for 1 year or 2 years, and again it can relapse. So we can't say definitely कि वैसा होता है. Then prostate cancer usually occurs in the older man, yeah? And you can see very common. And what is the most common cause of cancer is something to do with his prestige, his position, and his children. I've seen all the time there is some, so I always take ailments from problems with the children, ailments from disrespect, disregards, honor, loss of job, everything. And those remedies are considered mainly to prescribe in the individualization. One of that remedy, and then other are the pathological remedies. So it spreads commonly to lungs and the spine and the hip bone. Why? Again, there, once your status is lost, respect is lost, everything is lost, your finance will be gone. So finance, position, respect, lungs, and you cannot stand. You got your base is erupted. This is all now theorization from my side, but I am seeing like that in affecting why this metastasis goes here, why this metastasis goes there. So from there you can gather something till the time we get some scientific outlook for which I am looking for. I'm trying to gather everything, and surely I am writing it down slowly, steadily to finally write a book that how we can go clinically. So the prostate cancer is one of the common cause of cancer and 6th leading cause of cancer death in men worldwide. So usefulness of constitutional remedies with specifics given from time to time in this case proved to be effective in avoiding chemotherapy. He said, "Doctor, I want to die without chemotherapy, but give me some palliation so that I can die peacefully." That was his need. Huh? So he's an 85-year-old man. You can see his age, male, married, retired, and chief complaints were cough with white expectoration. So any case that we are treating of cancer, any symptom come, always think either to metastasis हुआ क्या नहीं. Don't say कि यार एक viral हुआ होगा, cold weather हो गया. Always be skeptical and start doing investigations. Dear friends, I would say that we all doctors in homeopathy are poor in investigating. Please do not bother about the cost that patient has to incur, because they incur more cost in the allopathy. And if you miss something and diagnosis is not there, people are not going to come to you. What they come and tell me, वो डॉक्टर ने तो स्टेथोस्कोप भी नहीं लगाया, बीपी भी नहीं लिया, कोई ब्लड भी नहीं चेक किया. Okay, it is so important that it keeps the reputation of homeopathy also. And we come to know, we know that it's not going to give us more clues, but it's going to give us clues for selecting the pathological remedies. So we had cough, poor appetite, edema, feet, breathlessness, numbness. So numbness of legs. So nerves are affected. Okay. Why I'm telling this? Because later on, why I've given the remedies, you will come to know, and selection of that remedies. Now, again, there is a second experience of mine, that if the case is with so much of metastasis and this, and if you give the exact simillimum, many times I have seen the case deteriorating faster. But it might be my theorization. No one is sure. Till that time, we all come together and place the same thing. In some other cases, I have given exactly what the individualization simillimum, and the case has not deteriorated. So again, I'm putting why this, because we are not sure. But this happens in some cases, not happens in every case. Why? I don't know, and we have to find out. We have to be very honest in telling that these are our limitations. That limitations, homeopathy doesn't have any limitation. It is a limitations of our knowledge, and it is our problem that we have not taken homeopathy ahead by doing proper investigation of the molecules at physiological level, pathological level. But today I am happy. In last, say, 1 year or 2 years time, I am seeing a lot of things that are happening. Now I am appointed as being an advisor in scientific advisory board in CCRH to carry out the research, and 120 research projects have been passed, and I've given my inputs that how the research should be, and hope so in next 5 years time we'll be in a better position. If someone says that there is no research in homeopathy, just tell them there are 5,000 publications in research. We do not know. I have gone through many research publications to see, because I'm a allopath first and then a homeopath. So I got that habit. You also all develop that habit, going to the research site, seeing what homeopathy has done in this particular disease, and you will get an answer. Now, the life sphere is sympathetic, lively, cheerful. He comes talkative. He is friendly to all my staff, and everyone brings sir, isko pehle le lo. He is 85 years. He cannot sit. So he's so friendly. Hobbies of reading book, writing inspirational thoughts, and newspaper and gambling. He was also a great gambler. Eldest son went into a depth, and he came to know later, and he was shocked. He was worried for his son. I told you prostate is concerned with the children. So much worried for his son and his future under mental stress for 3 to 4 months before onset of the disease. So this put him to this bigger problems. In appearance files, physical journals, medium build, dark, poor, 5 to 6 glasses of hot water per day. All this I do not give much importance when I'm getting the result at a particular pace. What I give more importance, I will tell you later on. There are bronchi both sides. Now, bronchi means there is a bronchospasm. Bronchospasm, edema, or mucus secretion more. Now, out of 3, our homeopathic remedies will also differ. If I get 4 or 5 remedies in repertorization, if I know the pathology, out of 5, which one to give, select, particularly when PQRS is not available. This helps me, and I give that remedy, and you get faster and quicker results. So, his chest CT scan shows multiple discrete lung parenchymal nodules seen bilaterally with subpleural predominance. The nodule shows 5 to 21 millimeters, the largest nodule in the right lung, 21 by 14. Also, you can see paratracheal, subcranial, hilar regions, largest nodes. Now, here again, nodes are involved, lymph nodes. So you take one by one organs. So what are the remedies that act on the lymph nodes? And what are the remedies after that which act? It means I have seen, if same case would have, I just imagine, it's my theorization. If same case would have gone to some another homeopath, he would have given this. He would have got some result. He got third, he was given different remedy. Still, he would have got the result. But finally, to arrive at a final result is to see and check. Just patient saying, "Mujhe khana acha lagne lag gaya, main sone lag gaya, I'm feeling energetic," does not mean that he is fine. We have to take the blood investigations. So prostate was also enlarged, and the size of common iliac node in few sub-centimeter size retroperoneal lymph nodes are seen. So this is the proof that he has got a very bad disease. Okay. Examination of nodular densities in the left upper and mid zone, bilateral prominent hilar and parahilar shadows. Okay. And finally, when we treated and finally we got the result in 2017, both lung fields are clear, hilar mediastinal glands not enlarged. This is a result of giving homeopathy. Now, you see this PSA. PSA from 184. Within the duration of 2 months of homeopathic treatment, it came down to 120. Okay, from 120, it came down to 20, and finally to 8.5. And there is one report that is missing. It had come to 5. That is normal. We We have lost that report. We have lost many reports, but whatever I could recover the reports, I am showing you. See, such a good improvement at the radiological level, at the PSA levels, tumor markers. We call this as tumor markers. Whenever you are treating cancer case, you must know which tumor markers to check, and you can go on the Google and search. There is no need that you should have a knowledge how to know. Even many cases, I am not a cancer specialist, but I had to study more about the cancer, and therefore I used to search the knowledge on internet. It's a very good place. You can also get. For that does not mean that you should have a knowledge. You can gain the knowledge. I am ever learning. Every day is a learning day for me. I learn new things every day. Never think that you are at top position, you are the boss, you know everything. No, it is not like that. One who thinks he is not a good doctor. The pus cells are also come down, epithelial cells are there. And finally, when he got cured, you can see the eczema coming up. Everywhere you can see the eczema. Now this has happened as per the Herring's law. This disease is externalized, inner is better, skin is worse. Now I am not given any remedy as per the classical prescription, but he has improved as per Dr. Herring's law. So how can you criticize now? These are the totality of symptoms that I had taken. These affectionate elements from excitement of the emotions, full care of others, egotism, grief consequences about communicative. This is all we have talked. And this is what is being done in homeopathy. But I go by the individualization and this. So his individualized remedy was Staphylococcus aureus. That was main. But I didn't start with Staphylococcus aureus. I started with Conmac. He had a severe cough, and the cough was like the mucus which is there is not coming out. And opium 30, because every cancer case I give opium 30 single dose. We have seen that many remedies, well selected remedies, not acting. The first drug of choice is opium. Why waste time? Even if you give one day and then start other remedies, nothing wrong, because you don't waste time. You come to know I've selected remedy, and after a month you come to know this is not even well selected remedy is not acting better. You lost 1 month's time and the cancer has increased. It has become more incurable. You have lost the time. You have to be very, very vigilant. You have to be acting smart and fast. Then only you can cure such type of cases. You can see why these remedies were given. I will show you. They were not given by mixing together, but they were given like today this, tomorrow this, and this was given any time when he coughs. Spongia was also given many times he coughs. So usually spongia comes at night, so used to take कि पहला डोज ले लिया तो अपन ने नेम भी अलग दिया मैंने, पावर डोज and this cough SOS. So the things are being told, and that is how when you label the remedies, they take it. They don't have to contact you back कि डॉक्टर साहब एक अभी खांसी आ रही मैं क्या करूं, अभी तू चलने दे, फिर मॉर्निंग में आना, फिर देखेंगे. Patient deteriorates by that time. So you have to speculate and think what problem is going to get. If you give well in advance, you will get many good results, and patients will not leave you. This is a total repertorization. You can see the Conam was standing the most, and therefore we are given. But if you see in the whole totality of all the symptoms that I have taken, Staphylococcus was more near to the constitution. So now why Kali Beach was, again, some mental symptoms were matching with the cancer of lungs and expectoration adhering to throat. This was the prescribing point. He used to say कि ऐसा लगता अंदर ताल की मैं निकाल दूं. He responded to that. Now, if I given Conamac, why should I give Kali Beach? If I would have thought, he would not have. So the disease was shifting fast, and therefore, shortest time we got this result. If I say go directly by a classical one remedy, wait, it will go, let the body take, and if it takes U-turn, you lost the case. So opium, I told you that I have given to every cancer patient as they get frightened. Anyone who comes to know, even you, me, I, everyone, cancer ho gaya, so we will also get shocked. and that needs to be treated because that goes and sits in the amygdala of the brain in the form of a chemical molecule which is going to give you always fear and not allow you to respond to any remedy that you are taking. So this is my prime prescription. Without this, I don't get success. I'm sharing you with because of that. The cough, which was more on talking and exertion, was not responding even to Kali Beach. Then I added Spongia. Even I foresee that Kali Beach will work only partially. I add another remedy so that the patient gets faster relief. Because Dr. Anyone has said rapid. Now, where is the rapid? If you keep the cough for about say 7 days, 10 days, infection will increase. By chance, he goes into pneumonia because he's already immunocompromised. You lose the case. He will land into with the allopath, and allopath will say homeopathy has done all wrong to you. So on 3rd, 12th, 16th, there was 1 to 5% relief. Keep on repeating, even if even if 5% or 1% is remaining, I keep on repeating the drug because I've seen that I've done a mistake, committed a mistake, stopping the drug, and again it comes very bad. That time it doesn't respond to this same remedy. I do not know what happens, but that is my practical experience. So you see, when I repertorize the whole, all that was in Kali Beach, that was in Spongia and everything, staph was standing the first remedy. So repertorization is a tool which is very important to me to decide what sort of remedies can be given. You cannot use snapshot and fixed remedies to any patient that comes to you. So the golden rule that I follow is always take the symptoms and repertorize. You get a group of remedies, then you use your brain clinically, homeopathically, classically, and then start making a plan that how should I plan the treatment for the disease. 6-12, there was 10 to 20% relief, and PSA came down to 120. Again, you see, I'm keeping except for addition of Staphylococcus aureus now and hypericum. Because numbness, jo hai, appetite increased now, numbness in the both lower limbs, it didn't show much of the improvement. So nerve remedy was added. And finally, he was feeling better after giving the numbness. So you can see 20 to 30% relief in numbness of both lower limbs. Hypericum work. Still, I continued giving all the remedies 1 day, 2 day, 3 day, 4 day, 5 day. And these are the SOS means whenever required. Even if they are required 2 times in a day, you take 2 times a day. Give that freedom to the patient that if it comes, if you feel like that, no, I want a remedy, instead of taking some cough syrups or crocin, I always give the remedies like this so that they don't resort to that. Then finally, he started saying there is wheezing since 2 days, and Timtat was added and breathless, keeping all the remedies same. And finally, at this level, the PSA came to 20.55 nanograms per ml, and he started getting cramps in the buttocks, cold with sneezing since 3 days. Now, when cold with sneezing started, I said, now this is the discharge that is coming up. Now here we should wait. We should wait. And the edema also reduced, but there was an aggravation in breathlessness, coughing, low backache, and wheezing. This was not responding still then, and the pro-BNP was raised. Okay. There was a left ventricular failure. You know, left ventricular failure, you give whatever cough remedies, that doesn't respond. Therefore, you should know how to understand what is a left ventricular failure, right ventricular failure. Then you can see कि right ventricular failure है तो digitalis आएगा. Even if it is fitting in 5-6 symptoms in the repertorization, it works very well. And finally, the skin was so bad, it was in psychotic eruption. So Tuja 6 was given because he says, now I'm going to apply something and take a relief. So we have to give relief in there, 80 to 90% relief. And finally, you see his PSA level has come down to almost normal. And this was a case which has taught me so many things. And I have put in front of you all the facts and figures what I have given. You may like it, you may not like it. That is not my question. But homeopathy has to be taken like this. So doses, always I prefer 30 potency or sometimes 6 potency in cancer, because I do not know. I'm afraid. I'm not sure. Therefore, I start with that. Some people I have seen cases others who have presented, they have given CM, MM, and all those, they got the result. So this is still a dilemma which I am into. So best what is your own experience? You can practice that. But the initial things prescribing at 6 and 30 potency, I always prefer because I am comfortable with that. So in discussion, we have seen this improving prostate cancer rapidly. A patient never underwent chemotherapy and responded to our treatment, relieved in all the symptoms that were satellite symptoms finally. And the report made everyone surprised at how this can come from such a high level to this without chemotherapy. It was a big surprise. Now then I went to a research. I see there is one research that has been on cellular and animal models by V. McLaughlin and et al. And you can see what they have written. Sabal constitutes the complementary treatment of choice with regard to prostate health. In homeopathy, Sabal is commonly prescribed for the prostate problem, ranging from benign hyperplasia to prostatic cancer. Authors' work assess the anti-proliferative effects of homeopathy of Sabal cerulata, Thuja, Conam maculatum. Now here we are given Thuja and Conam maculatum. We didn't use Sabal because it had not come into the repertorization anywhere. It comes, if it is there indicated, I would have picked up Sabal also to be given as a complementary remedy along with other remedies. So this is how I select and finally come. So this is a research. You can see the difference in reduction is likely to a specific doubling time of each cell line. Cell line, cancer cell lines research has been done. No effect was observed on MDA, 231 human breast cancer cell. They have been taken for as a comparative key. Isme only it works on prostate or everywhere it is working. So it's beautiful research have been done in homeopathy, but we are not aware. In our time during my MD education, every day, 3 to 4 is a journal club class. Means everyone will come, leave apart everything. I used to start my day at 5 a.m. in the morning as a house physician, and 5 a.m. go to blood collection, take the history, write all the new orders. By that time, it used to be 8 o'clock in the morning, and 8 a.m. boss used to come with tie and suit, and we were just moving in whatever dress we could come. And every patient, 80 patient, 90 patient admitted, every patient boss used to stand near every patient. There was a registrar, there was a lecturer, two housepots, and used to discuss the case, every case. Then give firing for what the house physician has done, nonsense, mistakes. And from there, we used to learn, they used to learn, we used to learn that. And that is how hard training was done. It is to go from 8 a.m. till 3 p.m. Can you imagine the ward round? 8 a.m. to 3 p.m. 3 p.m. boss used to say, come on now, come to the journal club, used to read the journal, give one coffee, and finally it was 4 o'clock. We had to rush back to the ward, 2 biopsies, renal biopsy, liver biopsy, lung biopsy, pleural biopsy, ascitic tapping, pleural tapping, everything finished, take the samples, give it to the laboratory. And finally, because 5:30, government hospitals closed down the laboratory, so we used to literally run with the samples, go place it there and come back, and then take one uttappa at 6 o'clock in the evening and one tea, and again go back to ward and again attend all the patients till 1 o'clock at night. It was such a hard training, and 1 o'clock only one pav bhaji. Today somebody offers me pav bhaji, I don't eat because 4.5 years I have taken pav bhaji and only one food. Lunch is not there. Breakfast is at evening 6 p.m. Such a hard training is given to an allopath. If this straight life of training is given to our homeopath, a day will come. You remember my words. Keep this. The homeopathy will be in the top of world, and we will be number one. Homeopathic science is a great science. You do not know. I do not know the powers of it, but I am sure when it will be scientifically proven and made it easy that every Tom, Dick, and Harry can prescribe homeopathy to the point. You will see Anywhere you go in the house, if someone is sick with fever, they don't go to a doctor, they take crocin and they get well. So such easy prescription when it will come in homeopathy. Homeopathy is far ahead and number one in the world because it really does good to the human beings. Thank you so much.
Thank you very much, Jaswant. Would you like to take some questions?
I didn't get you. I can't hear you.
Would you like to take some questions? If viewer wants to ask some questions, will you be okay with answering some questions?
Yeah,
guys, if you have any questions, you can ask them.
Yeah, I've kept free time, my dear, so you can ask, no problem.
Great. So guys, I'm asking from the viewers, if you all have any questions, you can ask them directly. अगर किसी को कोई सवाल है तो सर को पूछिए, सर है अभी. Hello. Doctors, thank you for the appreciation and gratitude. We would love to have your questions. You can unmute and ask the questions to sir. Okay. So nobody is asking a question. They are scared of allopaths anyways.
Hello.
Yeah.
Yes,
Good evening, sir.
Good evening. Tell me.
Sir, I'm asking for how much to wait. I mean, for the follow-up once the medicine is given. So how much to wait?
You have asked me a very good question. I thank you for that. It is really, I forgot to tell that. But I said you have to be vigilant. You remember? I see almost every patient every week, not 15 days, 3 weeks medicines. I never give.
Okay.
Because whether you are prescribed right, wrong, whether the patient is responding properly, whether there is some change in the symptoms that requires addition of the complementary follows well remedies, you should always see the patient every week.
Okay. Thank you, sir.
Thank you.
Hello. Good evening, sir.
Good evening.
Sir, nice. बहुत अच्छा था सेशन. मेरा एक क्वेश्चन था. सर, अभी आपने जैसे कैंसर का या अभी प्रोस्टेट कैंसर का आपने बताया ना.
हाँ जी.
तो एवरी कैंसर केसेस में हमें वो रिपीटेशन मतलब अभी कॉन्स्टिट्यूशनल मेडिसिन हमने निकाला, उसके साथ में जो सिम्टोमेटिक मेडिसिन आ रहे हैं, मतलब जैसे आपने ओपीएम दिया, स्पॉन्जिया दिया, कालीबाई दिया, तो ऐसे हर एक केस में करना है, जहाँ जरूरत है वहां करना है, कैसे मतलब ये करना है सर हमें?
Very intelligent question you asked. And मैंने भी ये फेस किया था, what you are facing now. तो ये इस पे what I used to do, मैंने एक्सपेरिमेंट करके देखा कि ये हो गया बंद कर दो, ये हो गया बंद कर दो, तो मैं फिर I used to keep watch on tumor markers. They used to increase. ऐसे अरे सिम्टम कुछ नहीं आया, इंक्रीज हो गया. Then I said कि since we are giving the remedies, okay, and this is a dynamic disease, इसमें आज कुछ है, थोड़ा सा ये होता है, फिर अपन not required, and if the medicine is given, it is all or none phenomena that I have seen. That is my practical experience I'm sharing. It is not given anywhere, but this is how I learned. I learned from my mistakes. I learned from the experiences, practical experiences. कि remedy दे दी, and if it is not indicated, it will not work. Neither it will produce the symptoms, because the vital force is already occupied with a very dynamic disease. And again, you are given other remedies. So it does not have time, and it does not have place to reproduce the symptoms like symptom proving. Many times in some cases, you see the symptom proving, and that symptom, when it comes, whatever remedies give symptom proving aya, so that time I stop that remedy and it settles down.
Okay. Okay, sir. Okay.
Hello.
Hello.
Hello. Thank you, sir.
Sir, good evening.
Good evening.
Dr. Geeta Shah speaking.
Yeah, Geeta, how are you?
Was fine. So in between I had asked about skin cancer.
Yes.
So, so skin cancer, which is now the growth is like 4 centimeters. No, not centimeters, inches, I would say. And in radius, so it is quite a big growth. With diabetes, blood pressure, renal failure, the doctors are scared to operate because it will be a problem for the heart because there is angina. So you think we can with remedies it can reduce? After
I have seen, see, I have shown this case. He had so many problems. Diabetes भी है, ये भी है, वो भी. Diabetes के लिए anti-diabetic drugs you should not stop. That is my first dictum.
Yeah, he is on insulin.
So you continue that and treat him symptomatically. Whatever is the prominent symptom, first treat that. But keep that remedy till the time the symptom has totally mitigated. And do a repertorization. Repertorization is very important because we cannot remember कि ये remedy, कभी-कभी एक simple remedy जिसका हम सोच नहीं सकते वहाँ पे वो काम करती है. And therefore homeopathy is ever evolving science and it has to be evolved to a larger extent. What we have understood is only 1% of power of homeopathy. Still we are.
Can we give different mother tinctures like for say renal failure ke liye this mother tincture, then another some mother tincture or few drops for the heart? Or would you suggest something like Cratagus for like angina pain? Can we give?
See, basically कैसा है? Why, what the pain is? You should know the diagnosis for that. Whether it is really a coronary artery disease pain, whether it is the myocardial pain, whether it is the valvular pain. Okay. So the prolapse valve, sometimes when the myocardium is weak, it can give rise to it. It comes with every heartbeat. So you must be, see, clinical knowledge, therefore it is very important. And that is what I am going to start. Clinical knowledge भी है, वो अपने को बच्चों को सबको सिखाना पड़ेगा. अभी I am being blessed with allopathy, therefore I could correlate and do all this type of things. But it is not very difficult also. तुम always try to see कि pain किधर है. And this pain, today the Google has given and now ChatGPT has come. AIs have come in the medical field. They give you whatever I think you can get an answer from there. And then accordingly, then you correlate with the symptoms and find out. So you should be sure. Now see what I said, I have seen that right-sided failures, I have seen digitalis response much more better. And even in allopathy, digitalis is used for right-sided failure. For left ventricular failure, they don't have many medicines except for dopamine, but that is given when it fails more. But reducing the preload. So what are the diuretic medicines in homeopathy? If they are used, okay, like Solidago is a very good diuretic. It has been helped in even serum, bringing down the serum creatinine when you are given a right remedy and still creatinine is not coming down. I would share one case of my cousin brother, whom 2-3 top homeopaths treated. He didn't respond. That time I was only saying, single remedy, classical. So he didn't respond. Finally, he has taken some William Chavez number. I don't remember the number. And he said, कि उसका पूरा proteinuria ये वो सब खत्म हो गया. I said, what is this? This is so many remedies mixed. This is nonsense homeopathy. पर बड़े अरे दादा मैं तो ठीक हो गया ना. मैं तो सबके पास गया ठीक नहीं हुआ, इससे ठीक हुआ ना. अब ये
that is a similar question I am trying to ask. You get scared.
I have answered. See, basically अपना जो एक tight compartment में हम रहते हैं ना, उससे बाहर निकले. कभी मुझे difficulty आई और कुछ mind का problem मुझे समझ में नहीं आया, I called लियाकत भाई. If you want some clinical, he calls me. We should be open and talking to each other and helping each other.
Yes.
So this is that we will learn and see what there are two things in give and take. Is that first of all homeopathy will come up and we will learn from each other. Even I have to learn more from many other people. Like I have learned from Dr. Sehgal, a very wonderful way of prescribing. I have learned from Liyakat Bhai. He has learned from me the clinical side. And every one of us is going to contribute. We should have a very good group where we can form this platform and we can exchange and ask the questions and remove our difficulties.
Should this PSA test done? PSA test should be done for squamous cell carcinoma of skin?
See, basically, you should first open up, and always, whenever a cancer case comes, you have to read. Okay. Now, I am not a dermatologist. I am not a cancer specialist. I am a homeopath. I am with the knowledge of pulmonary medicine, cardiology. But as a homeopath, I have to know all the sciences. And therefore, whenever such type of case comes, you have to refer to the internet, find out where the skin cancer metastasizes. I may not be able to answer you all the questions where it is. I'm not very.
There it is, yes. Okay.
I'm not that field. But if you find that there are some prostate symptoms, you do a sonography and see whether there are some. Whenever you are in doubt, you do the investigation. Don't be.
No, there are no metastases as yet because the lymph node was biopsy was done 15-20 days back.
Okay. So biopsy is done and prostate, if you feel, then go for PSA. If the prostate is enlarged and there is some lesions seen.
Okay. Yes. Thank you.
Thank you.
Thank you. We'll come back to you.
Can I intervene?
One question is that, sir, if the patient approaches and he feels like he should also go with chemotherapy or radiotherapy along with homeopathy, then what would be your suggestion, sir, this case?
Yeah, I'll tell you. See, if such case comes to me, what I do, I tell them, no science is perfect. You may get well, you may not get well. And same thing is with allopathy. You may get well, you may not get well. So what I would suggest you, take the treatment for about a month or 15 days. Know which parameter we need to see. Just patient is feeling better is not the criteria. The pathological criteria. Like I took PSA as my sole. I have done so many times PSA checking. Every 2 weeks I used to do PSA. Because I should be sure if I given the right remedies and medicine, PSA first has to come down. Baki patient ka bhook वगैरह सब आएगा जब when we'll give the constitutional remedy. Okay. Till first the disease control is very important. Otherwise disease has हावी हो गई है. तुम्हारा individualized remedy काम नहीं करेगा and then you will get a failure. तो इसके लिए always in cancer case first decide कि मुझे कौन सा parameter monitor करना है. Like I'll give you one example. A case of CA breast came to me. Okay, this lady was 65-year-old lady with CA breast. She was operated by a surgeon, and after operation, that said कि we will do chemotherapy and radiation. Okay, and chemotherapy और तुम्हारा histopathology का report आएगा उसके बाद में chemotherapy start करेंगे and radiation भी करेंगे. तो पहले chemotherapy करेंगे, radiation करेंगे या radiation पहले chemo, that is their plan. So that put in a port here because chemotherapy is very toxic. So they put a port always here. She came to me. I said, see, look here. Mole, can you save my chemotherapy? I said, give me a time. I will see. Now what I did in breast cancer, उसका कोई tumor marker तो breast का tissue निकल गया है तो कुछ अपने को समझेगा नहीं ये कम हो रहा है क्या नहीं हो रहा है. हाँ? So what I told her, give me 1 month's time. Are you ready to take the risk for 1 month? You may get well or you may get worse. But if you get well, you can see. Even if you get worse, chemotherapy is there to take care of you. In 1 month is not going to cause much of a problem in you. But it should be very clear understanding between doctor and patient. And बोले ऐसा क्यों? मैंने कहा ऐसा है कि कीमोथेरेपी देके अगर आप मर भी गए, कुछ भी हो गया, तो यू विल एक्सेप्ट कि भगवान की इच्छा थी, हमने बहुत अच्छा कोशिश कर लिया, तो सब ठीक हो गया. लेकिन होम्योपैथी से थोड़ा भी खराब होता है तो बोलेंगे क्या मुक्ता की you wasted your time in homeopathy, because homeopathy is not a well established science. We know that there are powers, so you have to be very candidly discussing with the patient. Don't keep them in dark. उससे क्या होता है, डॉक्टर पेशेंट फेथ रिलेशनशिप डेवलप होता है. Even today someone comes and I said I will try my best, I am not a god or magician to cure you all, and she waited for 1 month. There was very good recovery from physical, from general, and then now how I have to prove? And that treatment she extended. I said now you do PET CT scan. बोले डॉक्टर साहब अभी तो किया था, PET CT scan is done 6. मैंने कहा see, I have to be very sure that you are feeling better. I am sure that you have improved, but I cannot, what guarantee I can give. So उसने PET CT scan लेने के बाद दवा चालू रखी, and she did 15 days late. So it was 1.25 महीना का टाइम मिल गया था मुझे. 1.25 महीने में उसने PET CT scan किया, रिपोर्ट लेके all clear, and it was surprise, all clear. तो अभी उसको मैंने कहा कि तेरा तो कैंसर पूरा क्लियर हो गया, PET CT scan में दिखता है नहीं, दिस इज द एंड पॉइंट ऑफ स्टॉपिंग द कीमोथेरेपी बाय एलोपैथ्स. तो मैंने कहा तू अभी जा वो डॉक्टर के पास जिसने सर्जरी किया, उसको बोलना सर ये रिपोर्ट देखो और अभी आप डिसाइड करो मुझे कीमोथेरेपी लेना है कि नहीं लेना है. तो उसने तो पहला ही गॉट फ्यूरियस ऑन हर. In 1 month's time you are repeated PET CT scan. Who is this doctor and what are you doing? She said ki doctor, I believe in homeopathy. He has given me homeopathy and I was feeling absolutely, मैं खाना खाने लगी, you see my weight has gained, emaciation has gone, I have improved, you please see the report. तो उसने फिर खोल के देखा and he was surprised, he was astonished, speechless. बोले सर उन्होंने ऐसे ही कहा, कुछ नहीं बोला, ठंडे हो गए. बोले it is surprised that you have been cured. He was honest. He is a very well-known doctor in Mumbai, and he is a really good gentleman. He said, see, look here, you have been cured, but it may relapse, so keep on doing PET CT scan, and now chemotherapy is not required, so I will have to remove the port, and the port was removed. Got it?
Yes, sir. Yes, sir. Thank you very much.
Thank you.
Jaswant,
हाँ जी बोलो.
I want to add something what Geeta had asked. Na question. Geeta, Dr. Geeta is there still.
Dr. Geeta.
सवाल पूछ के चली गई.
Yes.
Geeta. See, my experience is when you said there are multiple organs involved. See, what metaphysics says is that there are multiple conflicts then. Okay. So there will be lots of obstacles to cure in that case. What case you talked about in skin regarding the skin cancer. Okay. So you have to take care of that also. You'll have to talk to the IPRs and take care of the obstacles to cure as to what exact conflicts are going on in between. Okay, that thing you'll have to remove. Second thing is, don't use mother tinctures. What Dr. Haniman has said, minimum 3C potency is what he advises as a dynamic potency. So any remedy you want to use, whether it's palatable or whatever, better is to use 3C potency, because I have used mother tinctures in cancer cases. Since last 5 to 6 years, I'm seeing almost at least one case a day, one new case a day of cancer. Okay, so mother tinctures, they're quite toxic. So better you use 3C potency. Okay. And my experience is, more the complications, easier the case to treat.
Okay.
When the case is very difficult, very complicated, you have lots of symptoms. Okay. The problem comes when there are very few symptoms to treat, the so-called one-sided disease. Okay, that is very difficult to treat because the vital force is so dull, because the reactivity of the patient is so low, so less is the reaction of the patient. You don't see the results also easily. If there are multiple, if he has renal failure, if he has cardiac problem, and then if he has Like so many things that you said. Even if you touch one organ and if there is result, you also feel good. Even the patients will stick to you then. All right. And in such cases, my experience is treat the killer first. Okay. Whatever is endangering the life first, okay, that you have to treat first with whatever remedy you are giving. Constitutional remedy, I don't believe in. There's nothing like constitutional remedies. Okay. It keeps changing. You can have 3-4 remedies that has been there in a person's life. Okay. It's very difficult to find one single constitution person throughout the life. They're lucky people. Okay. Those who are sorry and those who don't inherit more diseases from their ancestors. Like, if there is a very good family history for at least 2 generations, and no distant relative having suffered from psychiatric disease or suicidal or cancers and those sorts. So the lucky people, such people get cured very fast. Okay. So 3-4 remedies will come, just like what Jaswant Bhai said. Staphylococcus seemed like the remedy of the patient. Lucky to have such thing. But my experience is a person usually by the time he is menopausal, 45, 50, he goes through 2 to 3 remedies is what I have seen in my life. Okay. Out of that, one is a nosode, certainly. And in such cases where terminal diseases are there, one nosode will come, but don't use the nosode so easily. At least you should have 3 to 4 remedies, gone, and then you use the nosode. If you feel that the person is carcinosin or whatever, use that as a 3rd or 4th prescription, not immediately. And it's very simple. And watch for the fever after you give the remedy. Watch for fever because in my experience, fever is a killer. Okay. Very difficult to handle fevers in cancer cases or in any terminal case. Very difficult to, even if the person is coming to you from psychiatry, and if you're as a psychiatric case and then you are treating him for that and he's getting better, they usually suffer from very high grade fever. And then in that situation, it's very difficult to handle the fever. And many times, if the fever is suppressed by allopathy, very difficult for us to revive the patient and go back to the original self, what brought back the fever in him. Okay, so watch for fevers. Be very careful when treating the fevers. Be very, very vigilant. You might require to keep, to change the remedy almost every hour, like what Jaswant Bhai has said. Okay, but avoid mother tinctures. And I've never seen mother tinctures working in cases of renal failures also, because renal failure is one of my very favorite topics and very good results we get. Failure rate in renal failure is 1% in my life, is what I've seen. Okay, so renal failure, certainly you can actually treat and keep the patient alive for at least 20 years. 15 to 20 years तो आराम से 6 साल तो आप in any state you can, कोई भी स्टेट में अगर पेशेंट एक किडनी पर भी है या किडनी ट्रांसप्लांट पर भी है और डायलिसिस पे भी है तो मिनिमम 6 साल तो आप पेशेंट को खींच सकते हैं in renal failure. So don't worry about the kidneys. You have to worry about the heart, what case you told. Okay, because heart is a killer.
Yeah. Okay. So for this heart angina pain and all, should we be using those mother tinctures or no? I have not.
No mother tinctures. Mother tinctures doesn't go that deep. See, basically, you understand. Are you going to use the pathological element, the physiological element with what is there in the mother tincture? No, we are not going to use that. We are going to use the dynamic power of that element, whatever, whether it is digitalin, whether it is whatever, like if it is pyramid, if it is naxomica, we are not going to use the strychnine from that, right? We are going to use the dynamic action of the strychnine, right? So to have the dynamic action, what Dr. Hahnemann has said, minimum 3C potency. So use 3C potency. There's no problem in using 3C potency of whatever remedy you are feeling.
Okay.
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 Because I have seen mother tinctures to be very toxic, and my seniors and my teachers have seen euthanasias happening with mother tincture. So, because that guilt is very difficult, huh, Geeta? I don't know how old are you? Now I'm 50. I've been practicing since last almost 28, 29 years. If the patient dies, the guilt remains with you forever. And those ifs and buts remain with you, whether should I have given this remedy, whether should I have given this, whether I shouldn't have given this remedy. That guilt will be there with you, beta. So be very cautious.
Yes. Oh, yeah. Thank you. Thanks. Maybe I'll contact.
Yeah, Jaswant bhai. Any question for Jaswant sir? Yeah, LM-potencies are very, very useful, but cases where solitary cancers are there. If there are metastases, multiple cancers, LM-potencies are not very useful. Questions for Jaswant Patil sir? I am there always. He comes very rarely. Okay. Jaswant bhai, you are there, no?
Yeah, I'm there. I'm listening to you very patiently. What you said about mother tincture is my same experience. We should use 3x, 3C is the better.
Yeah, 3x is also very good. 3x is also
3x, 3C, anything you can use.
Yeah. Yes.
But mother tincture, sometimes they cause, because there is a gastritis, so there is irritation of the
exactly.
Exactly.
Okay. Can I interrupt in between? I have been some biochemic combinations also, like calcarea floor 6x.
Yeah, you can.
Yeah, very good. Yeah, very good.
And
in powder form, Gita.
Because hemoglobin also had reduced. So there is one anemia combination, number one.
That is very good. Very good.
So that was given. Then for cold and cough, again, some cold and cough combination also in between I had given. And like combinations, I think.
Biochemic you use in powder form. They work better in powder form than pills form.
Okay. So powder form, like I use the SBL usual.
Whatever. उसमें क्या है यार? देखो नाइट्रोमोल क्या है? नमक है. उसमें कौन सा एडल्ट्रेशन करने वाला है?
तो इसलिए
इसमें क्या? वो थोड़ी ना ऑरोमेट का 6x का पाउडर ला रहे हो आप कि सोने का 6x का ट्राइचुएशन.
नहीं.
इसमें एक मैं बात ऐड करना चाहता हूँ.
यस.
ये जो केन शुगर से बने हुए पाउडर्स है एंड मिल्क शुगर से बने हुए पाउडर्स. यू नो मिल्क शुगर से बने हुए पाउडर्स में, because it is being prepared from the milk, so many times the steroids in the milk are falsely detected.
Lactose.
And homeopaths have got a bad reputation because of that. I got to know that ये इतना बड़ा डॉक्टर उसके इसमें पॉजिटिव रिपोर्ट आया है. मैंने कहा he can never do this in the life. I told patient कि don't talk nonsense. You prove this with a gamma camera. What I say? You prove this with gamma camera, because these are the false positive tests that you can get, particularly in the milk sugars.
Yeah, exactly.
That is my observation.
Very true. Very true. Very true. Very nice question, Geeta. And my experience in cancers in old age gets very good results.
The age of the patient is 65.
Oh, you'll get very good results. Don't worry.
Okay.
Because see, cancer is a disease of old age. They go whatever disease, the diseases, we have diseases for ages, like छोटे बच्चों में सर्दी खांसी होती है, मिडिल एज के अंदर क्या होता है, टाइफाइड टीनेजर्स में आता है ना, जॉन्डिस 30 to 35 के एज में आता है ना, जैसे फाइब्रॉइड्स 40-45 मेनोपॉजल एज में आते हैं. तो वो जो एज के हिसाब से, अगर नेचुरल एज के हिसाब से आपको डिजीज आ रही है ना, तो बहुत अच्छे रिजल्ट्स आते हैं. दैट इज माय एक्सपीरियंस, बिकॉज दैट इज नेचर्स वे ऑफ taking your life, so in that you get very good results. Cancer at young age is very difficult to treat.
One Dr. Prachi has asked a question: is the approach same in each type of cancer? The basic baseline is same, but as per the symptoms, the remedies they change. So the process is take the history, pathology, what is there, what organs are involved, what are the organ remedies, what are the pathological remedies, what is the mind, what is the PQRS. So you sort out with the remedies and jot it down, and which to start with is first, that is giving the trouble more. if patient says I'm incessantly vomiting, then first attend that symptom. Because if you give something other and vomiting increases, the patient will leave you. So first the relief has to be given into the first presenting symptom. That is most important. So you come to know if there is a pain, the pain has to be relieved. Otherwise, patient is not going to take the treatment. And giving that is what I do in such cases. You give the remedy and ask for the come next day. And if there is a relief, then you start your all other treatments. And it is written, sir, tell also the miasmatic journey in the cases, please. Now, this miasm has troubled me a lot. This is my homeopathy. This is psychotic miasm. Means now the name, when I talk, this is syphilitic miasm. Syphilis to disease है, कैसा miasm हो सकता है? You know, then I realize what is miasm. After say 10, 15 years of going through the turmoil. Miasm is another name of pathology in homeopathy. Now, pathology are three broad-based. One is destructive, one is constructive or hyper, that is psychosis. Destructive is syphilis, and one is the functional changes. Functional changes in immunology, physiology, without much of a pathology, that is a sora miasm. So I come to a conclusion, अरे इसको सोरा बोलते हैं, इसको psychosis बोलते हैं, because that has confused me a lot. Now there are different miasms coming, tubercular miasm, cancer miasm, this miasm. So these are the pathologies. तो इसमें क्या है? Ultimately तीन basic colors होते हैं. वो basic color से सब color बनते हैं. ऐसा ये तीन basic pathologies है, जिससे different type of pathologies बनते हैं. उसको सब miasms बोलो, सब pathologies बोलो. That is up to you. That's all I think. I've searched any question is remaining to be unanswered. So if we have covered everything. Hand over to Liyakat.
Chalo, I think the questions are over. You can ask, sir is going to be there with us, friends. Any question that we will take one more question. Anybody wants to ask?
Good evening, sir.
हाँ खांडे बोल.
हाँ, sir, I have one doubt. We need to be vigilant, you said. So when the patient comes for follow-up, so how we are going to differentiate कि बाबा symptoms are going according to Hering's law, or the symptoms are which are by of the remedy itself? Like we are given wrong remedy, as you said, all or none phenomena. So how we are going to differentiate?
Yes, I'll tell you. It's a good question you asked. This has haunted me for a longer time, Hering's law. And then many times I was feeling this answer, what this thing has come, it has gone deeper inside from less important to more important organ. Immediately you have to correct by giving the remedies and bring to the order. If skin treatment is taken, or even if you prescribe anything in the skin and the inner problem starts, then you should know you have to change the direction. And this is what is a zigzag way. So therefore, you have to be vigilant. Why I said vigilant? If you give remedy and something happens, immediately you do correct the action by giving the remedies that is according to the present symptoms. So whatever has come to the surface, that needs to be treated. And finally, I've shown you this case. इसमें मुझे ऐसा ही लगता था. What question you asked is a very good question. Whether I'm in the right track or wrong track. So I started treating the symptoms what used to come to the surface. Now, if the patient starts getting a chest pain, that means your remedy has not done harm. What is the expression of the inner self? And we always terrorize. कि ऐसा किया ये suppress हो गया इसलिए बाहर आया. No, the pathology cannot develop in few hours time or 1 day's time. Pathology was pre-existing there, and it has emerged out. So it was not showing any symptoms. So you were not aware. Whatever remedy is given, at least has started showing the symptoms. So immediately that has to be addressed with the appropriate remedy rather than waiting. Got the answer?
Yes, sir. Thank you, sir.
Are you satisfied with the answer?
Yes, sir. Definitely. Thank you, sir.
Thank you.
See, Khande, Dr. Khande, what sir has said is very correct. Every symptom is an expression of the inner self of the person, right? So the defense of the person is going to express in the form of symptoms. You go to treat the symptoms, right? Very simple in that way. And it is not Hering's law of cure. It is actually Hering's observation of cure. It is not a law. All right.
Okay, sir.
It should be actually taken as Hering's
Observations,
observation of cure. That's not possible in all the cases. If you will be very lucky, I must have treated at least 50,000, 70,000 cases. I have treated 75,000 cases plus. But max to max 1,000 cases I must have seen the cure by Hering's.
Oh,
okay.
okay.
It's that not even 1%. If you read Dr. Vitholka's experience, he has the same experience. Even Dr. Vijayakar sir used to say the same thing. Very difficult to get Hering's law, the so-called Hering's law in every case.
Okay.
Only exteriorization, just like what sir has said.
Skin manifestations.
Yeah, means the elimination should start. Okay.
Definitely. Thank you, sir.
Yes, there was a question, na? Jaswant?
Which organ cancer can be treated with homeopathic medicine prognosis ways? Prognosis ways, which organ? Every organ can have good or bad prognosis, provided how you select the remedies, how you manage the case.
Yeah.
Psychologically, if you manage that case very properly and if you develop faith in you, and if you give results right in the first week, that patient says, I am going to get well, your remedies work well because the obstacle to the cure has gone.
Exactly.
One who has no faith and always doubtful, then you give your mind remedies and then clear that obstacle.
Exactly. Very true. See what Dr. Hahnemann has said about prognosis, the moral and intellectual character of the person. That is very important.
Dr. Ranjit Vora has asked.
Pune Ranjit.
Allopathic ointment for an skin condition suppress the eruptions every time. See, I'll tell you, not every time it suppresses, but many times it has suppressed. How we know that whether it has suppressed or not suppressed? Immediately you get the problems in the patient. Okay, like I was treating a case of post-COVID GB syndrome with urinary tract infection to such an extent that he has gone into septicemia. He was in ICU. I treated him and then he came out finally. He was on the bed at home. And from that state of diaper and urinary incontinence, he got well so well that he was going to the bank, signing, taking pension, attending marriages, and taking work in the society. So much of improvement. But what he started doing, he started getting itching. What a picture I had shown us, such bad skin eruptions that I said, my God, now it is a headache for me how to handle this man. So he used to say, Sir, raat bhar sota nahi, aati. You give me something or otherwise give me ointment. I said, I can't give you ointment because if I give you ointment, this case will be spoiled and you may have to go back to ICU. So he listened to me for a certain time and finally he applied the ointment and he again went into septicemia and went to hospital. So I said, what have you done? If you want to get well again, you have to tell me, sir, please डांटना मत, मैंने लगा लिया था, अभी मुझे समझा, अभी कान पकड़ता, अभी कभी नहीं करूँगा. And finally, same remedies I repeated, again the skin increased and he came out. Now in another case, what he has asked question, every time, there is a very particular word he has used. Ranjit has used a very particular every time. There was one case, he was a collector of Jalgaon, his mother was having knee problems. And I treated that knee problem and she got well, but she got eczema out. So I told कि देखो साहब ये eczema आया है, इसको कुछ लगाएंगे तो किडनी घुटना इतना खराब हो जाएगा कि उसको बदलना पड़ेगा. Confidently I said. And shala bloody nothing happened. The skin was suppressed by the dermatologist. And I was waiting, ये कब आएगी, कुछ आई नहीं. See, you will learn from the experience. पर then after 12 years he got transferred. तो मैंने ऐसे ठीक है, अभी तो आया, अभी तो हुआ होगा उसको कुछ ना कुछ. बोले she is ANRT. Now this is another case. This is, so there is no hard and fast rule, but 90% of the time I have seen that applying skin and you are getting into another problem, it is immediately it shows the reactions.
Yes, thank you, sir.
Thank you.
But difficult to judge which case you should give allopathic ointments or not. So better don't give.
The dictum is till the time you don't give, let him take. So you will come to. If you give, many times I have seen that it becomes a problem. कभी-कभी eating इतना गंदा होता है, इतना खराब होता है, तो उसमें opium I have tried and it doesn't cause suppression, but it cools down the mind.
And pathology भी देखना होता है ना, समझो liver का problem है, तो फिर other चीज आएगा.
उसका मैंने remedy repertorization में individualization PQRS भी निकाल के दिया, तो कभी-कभी that remedy देने के बाद अगर serious illness से बाहर आया है, तो उसको problem होता ही होता है.
Exactly.
तो डर लगता है उसको, मतलब इसलिए तो ये साइंस को इवॉल्व होना चाहिए ना. हम लोग सब थेरराइजेशन पे काम कर रहे हैं, पर्सनल एक्सपीरियंस पे काम कर रहे हैं, इधर कोई ऐसा प्रॉपर प्रूव किया नहीं. जैसे एलोपैथी में पूरा एक मॉलिक्यूल ऐसा पूरा उसका A to Z निचोड़ के रख देते हैं कि क्या है इसकी एक्शंस, और ये भी बताते हैं कि इससे सीरियस साइड इफेक्ट होके मर सकता है वो.
हाँ, वो भी बताते हैं. Dare to tell.
They tell everything.
बेटर है बोल के मोकले हो जाते हैं ना, अपन नहीं बोलते हैं.
और लोग कितने अपन मोकले नहीं होते कि अपने को ही मालूम नहीं कि सच में बैड इफेक्ट होता है.
एग्जैक्टली क्या है.
हाँ, ड्रग प्रूविंग में सिर्फ ह्यूमन में सिम्टम्स प्रूविंग हुए हैं, और फिजियोलॉजी ये तो होना चाहिए ना. अभी मैंने वो CCRH में वही कहा कि वी मस्ट डू, और ऐसा ये केस किया जैसा मैंने ये रिसर्च का एक क्यों दिखाया मैंने लास्ट में, इसलिए दिखाया कि आप लोग अवेयर होंगे. जो नहीं है अवेयर, बहुत सारे तो होंगे, पर जो नहीं है अवेयर, उन्होंने हमेशा रिसर्च गेट पे होम्योपैथी का रिसर्च देखने की आदत डालनी चाहिए. अपन सब लोग ये करेंगे ना, हम सब लोग अपन ओपन अप होएंगे ना, और रिस्ट्रिक्टेड नहीं रहेंगे. जो मुझे आज समझा है पूरे होम्योपैथ्स को बता दो.
एग्जैक्टली.
तो होगा. अभी मेरा खुद का एक 20 मिलीमीटर्स का 21 मिलीमीटर्स का स्टोन साला सर फट गया, तो भी डिसॉल्व नहीं हो रहा है. 11 स्टोन्स चले गए, लाइकोपोडियम, परेरा, बर्बेरिस वर्ल, ये वो कॉन्स्टिट्यूशनल, सब ने बड़े बड़े लोगों ने भी कॉन्स्टिट्यूशन बताया, सबका लिया. बोले नहीं, इसको तो सर्जरी करना चाहिए. मैं अड़ा हूँ कि नहीं करने का सर्जरी. लास्ट 5-6 years मुझे कोलिक आता है तो रुक जाना पड़ता है, ओपीडी तो रुकानी पड़ती है. 5 मिनट में ठीक हो जाता हूँ मैं, 5 मिनट.
It must be preventing you from getting into some deeper pathology.
मेरा पूरा सोनोग्राफी कराता हूँ every month.
नहीं, that stone which is not going,
हाँ,
it means that it is keeping you away from some going into.
वो तो हो गया अभी डेड स्टोन, वो जो फॉर्म हो गया है वो तो डेड बॉडी है वो. लेकिन वो डिसॉल्व कौन से मेडिसिन से होगा, ये इस पर मैं बहुत रिसर्च कर रहा हूँ. और मैं इसके लिए मैं कहता हूँ कि मैं ये इस पर रिसर्च कर लूंगा और फिर सबको बता दूंगा. तो 21 मिलीमीटर्स को जाओ सर्जरी कर लो, ऐसे अपने होम्योपैथ्स को बोलना नहीं पड़ेगा. क्योंकि किसको भी पूछता नहीं, वो नहीं निकलेगा, वो नहीं निकलेगा.
नहीं निकलता
है तो नली छोटी है तो नहीं निकलेगा, लेकिन डिसॉल्व करने की तो कोई रेमेडी होगी. कोई तो
ब्रेक होता है.
हाँ, स्टैगॉन कैलकुलस, किसी ने एक कहा था कि मैंने स्टैगॉन कैलकुलस क्लीन कर दिया.
अरे मम्मी का गया था ना अपने स्टैगॉन.
गया था ना. कौन सा रेमेडी से गया था?
मम्मी का सेपिया से गया था.
हाँ,
सेपिया से गया था. उसका क्रिएट कभी बढ़ा ही नहीं थी. 1.5 के बाद में.
क्रिएट में मैंने देखा है सेपिया, नेट्रम्यूर, लैकेसिस, लाइकोपोडियम, ये बहुत इमर्ज होते हैं रेमेडीज.
सेपिया से गया था मम्मी, पूरा गया था. 52 mm था मम्मी का. थोड़े छोटे टुकड़े रह गए थे, एकदम छोटे 4 mm, 5 mm, 12 mm ऐसे रहे. इट ब्रेक्स, टूटता है. और स्टोन अगर है ना ज्यादा साल के लिए, तो वो प्रिवेंटिव है, कोई तो चीज को बचा रहा है. बिकॉज मेरे पास में भी 3 केसेस है कैंसर के, जिसमें स्टोन नहीं जा रहा है, कैंसर के अंदर बहुत अच्छे रिजल्ट आ रहे हैं. वो बचा रहा है कोई चीज से अपने को. अपने को डेड स्टोन लग रहा है ना, बट वो एग्जिस्टेंट है ना बॉडी में.
Correct. I think we have answered all the questions.
अच्छा हाँ, प्रणीता must be said ना. Okay, no more questions I guess. Sir will be coming back again, guys. Okay, soon. Thank you very much, Jaswant bhai.
Thank you.
Thank you very much, everybody, for the patient listening and listening to whatever experiences Sir has shared, and I have interfered in between.
Thank you.
Thank you so much. It's been a pleasure and a blessing. Like I said, whatever reward Dr. Jaswant Patil is getting, I don't know, but he is an award for homeopathy. For me.
Thank you so much.
Thank you
so
very much,
nice of
Jaswant
you
bhai.
all.
God bless.
And hope that we will be sharing the knowledge. Whatever comes, the final goal of my is to see that the homeopathy stands number one in the world. Because not for homeopathy, because it is a real science that is going to help the humanity. It is not love for the homeopathy, it is for the respect of homeopathy, considering the human beings.
Exactly. Exactly. I call homeopathy as humanopathy.
वो सबके लिए जो भी साइंस लेके जाएगा विदाउट साइड इफेक्ट्स, रैपिड जेंटल परमानेंट रिस्टोरेशन. जेंटल मींस नो साइड इफेक्ट्स.
Exactly.
वो अपना व्यू डॉक्टर एनिमन ने बहुत अच्छे वर्ड्स लिखे हैं, उससे फॉलो करेंगे. चलो बाय.
Exactly.
Thank you both the sirs.
Thank you. Bye.
Thank
God
you
bless
both the
you.
sirs.
Thank you.